My pain prior to surgery, probably about a year and a half before I started having pain in both of my hips. And it took me probably a year before I finally went in, when I was almost limping, and that's when I decided I needed to go in and see Dr. Kuesis. 12 years ago, I saw Dr. Kuesis when I was 35 and had some issues with running. So I had met him. I worked for Alexian Brothers, and you talk to the top people and you say, who do you need to see? And they said you should see Dr. Kuesis. So I saw him 12 years ago and was able to make it 12 years, and then finally the pain got pretty bad in the last year and a half and decided I need to have surgery. My first hip replacement was done end of January, and then my second one was end of July. Dr. Kuesis provided educational materials, the sites to go to, and then again, because I work at Alexian Brothers, I had a friend who was getting a knee replacement done by him, and just word of mouth. It's interesting, all the people that have worked with Dr. Kuesis recommended Dr. Kuesis, so it was nice his name was very well known in the community. Probably the summer before surgery, I was to the point that I could barely walk. I would go for a walk with my neighbor, and I'd have to stop and kind of stretch a little. So I couldn't even walk at some point. Then that's when I finally said, you know what, I need to go back in. I had the surgery at Alexian Brothers Medical Center, and there was a great team approach. So between the doctors, the nurses, everyone, there was a great team. So it was very good customer service. Pain-wise, it was very good. It was like staying in a hotel. It was really nice, and I was very, very happy with it. So I had the posterior procedure done, and I'd say, what is this, 4 or 5 inch incision, which seemed really good, seemed to go fine. You just have the hip precautions for the 12 weeks, but it was great at the hospital. That same day of surgery, maybe 4 or 5 hours, you are standing up already. So it's amazing that people can't believe that the same day of surgery, you are up, moving, and the next day you're walking, you're going to physical therapy classes. So you are up and moving very quickly with this procedure. So I was in the hospital 3 days for surgery, and then was able to go directly home. And at home we had home health for nursing and physical therapy, and then after 2 weeks, then I started outpatient therapy and had my follow-up doctor's visit. So I was able to, with the home health help, I was able to get around really well within a few days. I would highly recommend Dr. Kuesis and Core Orthopedics and Sports Medicine, and I actually have probably referred 3 or 4 people now. What was kind of neat is I have a woman I work with whose husband was having some issues. She heard that I was having surgery, so her husband had surgery probably a month before me, was calling me, checking in with me, after his surgery, letting me know how it's going. So when you have great results, you're happy to talk to people about it. So I told him I probably have gotten many referrals already from me. Or it's also being a younger person having surgery. I have a couple friends that are like, you know what? I just said, how long do you want to live in this pain? I mean, even though we're somewhat young to be having surgery, your quality of life's important. I said it's worth getting done just to be pain-free, and you don't want to be taking anti-inflammatories and all that. You want to be able to live a normal life, and it doesn't matter how old you are, you want to feel good. I would highly recommend Dr. Kuesis and Core Orthopedic and Sports Medicine.